Hi, I'm Dr. Mark Poray, a chiropractor in North Whitby, and I deal principally in family chiropractic and sports injuries, and I've been in practice for about 27 years, a little bit more than that. Today I want to talk to you about the frequency of visits to your chiropractor. How often should you go? Do you have to go forever? And so on. Remember that the primary goal of chiropractic care is to provide sufficient care to restore health, to maintain it, and to prevent any recurrences of the problem that brought you in. If used appropriately, chiropractic can reduce pain, improve function, and promote health. Inappropriately used, it can become a passive approach to promoting patient dependency, and that, of course, is what we want to avoid. Your treatment time itself is based on subjective and objective findings from a history, a physical examination, and this may include lab tests such as x-rays, and of course the diagnosis. The treatment time is subject to 4 conditions. One is if there has been a delay seeking treatment. 2, if the pain is severe. 3, if there is a history of several previous occurrences or episodes. And 4, is the injury superimposed on a pre-existing condition. As I've mentioned before, each person is different, but a study by Triano in 1991 found that with less than 8 days of pain prior to the onset of treatment, it should be about 2 weeks to restore full recovery. If it's been more than 8 days prior to treatment, then it could be 3 weeks or more to recovery. Again, if there is less than 3 episodes of previous occurrences, then it could be about 2 weeks to recover. And if there are more than 8 episodes of prior occurrences, then it could be 4 weeks or more to recovery. So there's a number of factors that you have to consider when you decide how long it's going to take to recover. Once you and your chiropractor have agreed on the history and the diagnosis, you can begin treatment, which includes two types of care. First is passive care, and this is in the initial stages. It's to promote resting of the injury, to decrease muscle spasms, and to reduce inflammation and alleviate the pain. The second approach is active care, and this is done to increase pain-free ranges of motion, to minimize the deconditioning that occurs during the rest. And then, of course, there's the rehabilitation portion, which is to restore strength and endurance and to increase physical work capacity. The care itself can take on 3 possible approaches. There's acute care. If care is started within 3 weeks, this will include a short period of a passive approach. When pain or discomfort abate, then you quickly switch over to the active care. And when maximum ranges of motion have been achieved, then you can start the rehabilitation. Chronic care is the second type of care that we have. So acute care and then chronic care. When a condition has existed for more than 3 months, and I know that this is a bit of a problem now between acute and chronic care, but between 3 weeks and 3 months, you can go either way. So if it's been more than 3 months prior to treatment, then it may take up to 4 weeks of trial care or up to 12 treatments to determine whether chiropractic can help. If there is no change after 2 to 3 weeks, additional investigations into other contributing factors need to be looked at. Factors like anxiety, depression, family turmoil, etc. These are all things that need to be investigated. They could be contributing to a lack of progress. Finally, we have elective care. This is also called maintenance or preventative care, and it is started after the maximum therapeutic effect has been reached. Clinical experience and several emerging studies support this concept as long as the patient does not become dependent on the care. For example, there is now growing evidence that sacroiliac joint dysfunction occurs in a large percentage of normal school-aged children, both elementary and secondary levels. That study by Lewitt and Janda in 1984 was later repeated and supported by Micro et al. In 1992. So in 1992 as well, Scott Haldeman studied how these sacroiliac problems can have somatovisceral, and visceral somatic reflexes. In other words, spinal joint dysfunction caused and or was caused by internal organ dysfunction. Another study by Lewitt and Janda showed that sacroiliac joint dysfunction could be and was corrected by daily sacroiliac joint manipulation for 2 to 3 weeks. This was repeated and supported by Cicaldi, Willis, and Cassidy. So there's a number of studies that support the chiropractic approach to spinal care for visceral problems. Therefore, when you and your chiropractor plan a course of treatment, they should, when following the clinical guidelines for practice in Canada, look something like this. In uncomplicated acute cases, 3 to 5 sessions per week for 1 to 2 weeks. If there's no improvement, then there can be a change of treatment and you try again, 3 to 5 sessions per week for 1 to 2 weeks. Thus, between 6 and 20 treatments are appropriate for uncomplicated acute cases. In complicated cases, 3 to 5 sessions again per week for 1 to 2 weeks. If there's no improvement, you can try another approach for 3 to 5 sessions for 1 to 4 weeks. In this case, in a complicated case, between 6 and 30 treatments are appropriate. If there's no change occurring, then alternate treatment needs to be explored and chiropractic should be halted. Elective care, which we talked about before, is decided on between you and your chiropractor and generally should not exceed more than once per month. I personally recommend anywhere between once a month and once every 3 months. I do have cases where that's not is not what happens. In the case of mechanical adjusting, I may include twice a month. Okay, so that's everything for this. Hopefully I answered all your questions. If you have any other questions, please refer to my website at www.drporay.com or give our office a call at 905-655-5767 in North Whitby. Thanks very much for your attention.